Health headlines now. The first ever blood test for depression through new technology. It's a new way to diagnose patients objectively. Nicole Gonzalez explains exactly how it works.
I was very relieved that there was actually something that could possibly validate how I truly felt.
Jane doesn't want her identity revealed. She says it's because there's still shame associated with major depressive disorder, or MDD.
I think this blood test could really help maybe lower and lessen the stigma of a mental condition.
That's in part why his company created the first blood test to diagnose depression.
There's never been a blood test to aid in diagnosing these neuropsychiatric disorders. So this will be truly groundbreaking.
Ridge Diagnostics developed the science for MDD score in 2007, but this is the first year it's being used by physicians.
It helps validate the diagnosis for me as a psychiatrist.
Dr. Marcella Wilson uses the technology in conjunction with her clinical evaluation. It works like this. The patient gets an ordinary blood draw that's sent to a lab. There, technicians analyze the blood for biomarkers or physiological changes that occur when a patient is depressed.
People are tired all the time. They don't want to get out of bed. That's a physiological change. That some people just can't eat. That's a physiological change.
The score is on a scale of 1 to 10, 10 being the highest likelihood for depression. Jane got a 9.
I was surprised how high it was, but I wasn't surprised because I do know how I feel inside.
Psychiatrists say most people like that the test confirms their feelings as an actual biological disorder.
Everybody's telling them it's in their head, meaning they're making it up, that there's nothing really wrong. If they would just pull themselves up by their bootstraps, they would be fine.
Jane says it's helped in explaining to her family and friends.
I can actually show them on paper, well, this is what's going on, this is how I'm feeling, and this is why, medication is such an important part of my life. I wish I would have found out about it 15 years ago.
That was Nicole Gonzalez reporting. The test should be available across the U.S. in about a year.